Hello, my name is Daniel Tvetin, and I'm a fourth-year medical student at a Level 1 trauma center where I have witnessed patients live and die after experiencing life-threatening bleeding. The purpose of this video is to prepare you so that if you ever witness your loved ones or a stranger experiencing life-threatening bleeding, you are prepared to act quickly and save their life. Watching the news lately has prompted me to make this video. We have been saddened by seeing events where people have bled out following traumatic injury, and I want you to be prepared so that you know how to act. Bleeding is the #1 cause of preventable death following trauma. The adult human body contains approximately 21 cups of blood. That's not very much when that blood is squirting out of you. Children and infants contain less. An infant human contains approximately just 1 cup of blood, so that's not very much in the event of injury. It takes only 2 to 5 minutes for a human to experience critical blood loss following major arterial injury. So your reaction time must be quick. You must be prepared to act and not freeze or panic. Luckily, if you are able to stabilize the bleeding long enough for emergency medical services to arrive and that patient to be transported to a hospital, their chance of survival improves dramatically, and you can save their life. However, before I continue, I must mention that this video will contain graphic images and video footage designed to prepare you to act effectively if you should find yourself in such a situation. So, viewer discretion is advised. Okay, I have 5 steps for you. Step 1, ensure safety and activate help. Quickly assess the situation for ongoing danger and instruct multiple bystanders to call 911 and seek supplies. The reason you must instruct multiple people if possible is because you want to ensure that at least one person will succeed. If anything should happen to inhibit the others from finding the supplies or from finding their phone to call 911, you want to make sure at least one person will quickly succeed and do the job. So tell as many people as possible to go and call 911. But do that in just a few seconds. Don't let it stop you from quickly approaching the victim. Step 2. You must identify the source. Expose the wound quickly. If it is under clothing, quickly move that clothing, pull up a sleeve, remove pants if they're easy to remove. If not, your #1 priority is to, step 3, apply firm and direct pressure to the wound. Look for pulsatile squirting bleeding, clothing that is rapidly becoming soaked or pooling blood. Once you find the wound, try to localize it to the exact area of the bleeding. Arterial bleeds have a very high pressure, and so you need to apply a very firm pressure to block that bleeding. And once you have applied pressure and you have stopped the bleeding, resist the temptation to lift your hand and check on the bleeding. Remember, the adult human only has 21 cups of blood and children and infants much less. Every time you lift your hand and blood leaves their body, you are losing precious cups of blood out of that individual. So hold pressure and then maintain that firm pressure. Step 4. This is optional. If you have the supplies, then you could place a tourniquet or pack the wound with cloth material. A situation where a tourniquet would be appropriate is an injury to the arm or to the leg. A tourniquet is a constricting device that is placed around the limb. While you are holding firm pressure, you could instruct another individual to remove the tourniquet from its packaging and place it around the limb and constrict it to cut off blood flow to that limb. That will prevent life-threatening bleeding for the temporary duration until they can be transported to a hospital and receive definitive medical care. However, some injury locations are not amenable to placing a tourniquet. For example, you would not place a tourniquet around a person's neck. And some places, like on the abdomen or the groin, would be difficult to effectively apply a tourniquet. So in this situation, if the injury is deep, you could find relatively clean cloth material, because I doubt you will have sterile gauze in your handbag just with you in the time of an emergency. So if you have a shirt, a scarf, or some other relatively clean form of cloth, you can forcibly, with 2 fingers, or just 1 if it is a small wound, ram that cloth material into the wound so that you can pack it with high pressure to tamponade and block off that bleeding, preventing it from leaving the body. Once you have forcibly packed that wound with a high pressure packing, then with your hands, maintain firm direct pressure on that packing to prevent additional bleeding. And step 5, you need to hold tight and remain focused. Make sure that you continue to apply firm and direct pressure until emergency medical services arrive. If you are waiting for a significant time, if you have placed a tourniquet, you could instruct someone to remember the time the tourniquet was placed, as this information could be useful to medical providers later. Also, if the person is potentially suffering from hypothermia, if they are cold, you should take measures to keep them warm, bringing blankets or trying to keep them warm and dry, because once a person becomes cold, their blood has a more difficult time clotting, which can prolong bleeding. Also, cold hearts are not as effective at pumping blood around the body, and cold blood is not as effective at carrying oxygen. And you need to continue delivering oxygen to their brain and vital tissues. So keep the patient warm if possible. But remember, your first and number one priority is to maintain that there is constant pressure applied to that wound so no further bleeding occurs. Now, to conclude our video, we will cut to a video that occurred during a hockey match in which hockey player Clint Malarchuk was injured and sustained a laceration to his neck, from which he began bleeding. Luckily, athletic trainer Jim Pizzutelli, who was a former Army combat veteran who served in Vietnam, rushed to the scene, identified the location of bleeding, and applied firm pressure, stopping the bleeding. You can observe that many other individuals rushed to the scene to help transport the hockey player to the hospital. However, Jim, he knew that you must maintain firm pressure because often a patient will rapidly exsanguinate and lose their critical volume of blood before they can even reach the hospital. So you will observe in the video that he remained with the patient, holding firm pressure to the wound location, because without that, there is not enough time to transport the patient to the hospital before they lose a critical volume of blood. Okay, here we go to the clip. So it looks just like a normal hockey match. Everyone seems to be having fun, playing their hearts out. And then they come in to score the goal, and this is when the injury occurs. So there's a collision. You can see the hockey player is holding pressure to his own neck while blood is pooling on the ground. Other people are going to seek help. They're observing. But Jim Pizzutelli, he approaches the patient and applies direct pressure to the location of the injury. Now they're transporting the injured player, Clint Malarchuk, off the field, where he is then transported to a hospital and his life is saved, thanks to the quick intervention of the athletic trainer and former Vietnam combat medic. Thank you so much for watching this video. I hope that the skills you learned here will be helpful if you should find yourself in a situation where a loved one or a stranger is experiencing life-threatening bleeding. You can continue to supplement your education by resources that are available online or free classes that are available. Just Google "Stop the Bleed" and find locations near you. Thank you.